Hi everyone, my name is Kristen Trice, and our project examines HPV vaccination in underserved communities across the United States. Human papillomavirus, or HPV, is one of the most common sexually transmitted infections in the world. It's also a leading cause of preventable cancers, including cervical, anal, and throat cancers. According to the Centers for Disease Control and Prevention, vaccination is recommended for all adolescents starting between the ages 9 and 12, with catch-up vaccinations through the age 26. Although the vaccine is safe and highly effective, vaccination rates across the United States remain uneven, particularly in low-income, rural, and minority communities. These disparities are caused by barriers such as limited health care access, misinformation about vaccine safety, and a long history of mistrust in the medical system. This issue matters because HPV-related cancers can be prevented through vaccination. So when large groups of people, especially in marginalized areas, don't get vaccinated, those preventable diseases continue to harm families and communities generation after generation. For my section, I focus primarily on the theoretical framework guiding our research, what's known as the critical approach to health communication. Unlike individual-based models like the health belief model, which focuses on personal choices, or social cognitive theory, which looks at individual behavior and learning, the critical approach examines something deeper: power, policy, and structure. It helps us see that health disparities, like low HPV vaccination rates, don't just happen because people don't care or because they're uninformed. They happen because of inequities in our healthcare systems, policy decisions, and cultural messaging that shape who has access to information, trust, and care. The critical approach reframes public health not just as an individual responsibility, but as a social and systemic issue. It challenges us to ask who benefits from the current system, who is left out, and how can communication be used to promote justice and equity. The critical approach helps us connect today's health disparities to their historical and structural roots. For example, many Black and Brown communities in the U.S. still carry the generational impact of medical exploitation and neglect. One of the most well-known examples is the Tuskegee syphilis experiment, where Black men were misled and denied treatment for decades. That history didn't just cause harm in the past, it created mistrust that continues to influence people's attitudes towards medicine and vaccination today. The critical approach calls for health communication that is culturally grounded, transparent, and justice-oriented. It urges health professionals to recognize that how we communicate is just as important as what we communicate. This means moving beyond one-size-fits-all campaigns and toward community partnerships where doctors, policymakers, and educators listen to the lived experiences of people they're trying to serve. Instead of treating low vaccination rates as failures of individuals, the critical approach reframes them as evidence of systemic issues. Things like income inequality, limited insurance coverage, and underrepresentation in healthcare leadership. When we apply this framework to HPV vaccination, it becomes clear that structural factors are the main drivers behind the gap in vaccination rates. For example, data shows that children with private healthcare insurance are 41% more likely to receive the vaccine, while those on Medicaid or without insurance are far less likely. This isn't because one group cares more, it's because access and affordability are uneven. Cultural and language barriers also play a role. In many Latino communities, for instance, there's limited access to bilingual healthcare providers or materials that explain the vaccine in culturally sensitive ways. Families may not know the vaccine prevents cancers, not just an STI. The critical approach shows that to increase vaccination, we must improve access and trust at the same time. That includes partnering with community leaders, barbers, pastors, teachers, and parents to co-create messages that connect HPV vaccination to values like family protection, legacy, and community strength. In short, this theory teaches us that health equity isn't just about information, it's about empowerment. It's about giving people the tools, the trust, and the cultural respect they need to make informed health decisions for themselves and for their children. In summary, the critical approach to health communication is essential to understanding HPV vaccination disparities in underserved U.S. communities. It shows that improving health outcomes means addressing inequality itself, the policies, systems, and histories that shape health behavior. When communication is used as a tool for inclusion, empowerment, and justice, we move closer to a world where everyone, regardless of race, income, or zip code, can benefit equally from preventative health care. Thank you for listening.